Ever felt like your stomach's planning a surprise party and forgot to tell you? Yep, we're talking about nausea and vomiting. Two of the most uncomfortable and confusing symptoms your body throws at you. Imagine you're on a road trip. Everything's perfect until your stomach flips like it missed the memo. That's nausea for you. Sudden, stubborn, and oddly dramatic. Today on DocDecoded, we're diving into why it happens, what causes it, and when it's more than just a queasy moment. First things first, nausea is the feeling that you might throw up. Vomiting or emesis is the actual act of throwing up. Think of nausea as the annoying warning notification and vomiting as the system restarts. Nausea and vomiting are controlled by a part of your brain called the vomiting center, located in the medulla. It receives signals from your stomach, inner ear, bloodstream, and even your brain's emotional centers. So yes, a bad smell, a spinning ride, or even a stressful thought can trigger that queasy feeling. Muscles of the organs and body response stereotypically during emesis. This causes an increase in the pressure inside the chest and abdomen to evacuate the stomach, resulting in vomiting. Do you know an interesting fact? This vomiting and nausea is closely linked to an electrical phenomenon. Under normal conditions, contractions are distally coordinated by a slow wave which cycles at 3 cycles per minute in the stomach and 11 cycles per minute in the intestines. During vomiting, these slow waves are abolished and replaced by oddly propagating spikes that evoke contractions in opposite directions to facilitate expulsion of gut contents. Let's look at the usual suspects behind that dreaded urge. Gastrointestinal infections, like food poisoning, viral gastroenteritis, or stomach bugs, other digestive issues. These irritate your gut lining and send a clear message to eject whatever's inside. Motion sickness happens when your inner ear says, "We're moving," but your eyes say, "We're sitting still." Confused brain is so nauseous body. Unpleasant thoughts or smells originating in the brain also act as emetic stimuli. Ulcer, malignancy, or any kind of inflammation and obstruction in any part of digestive tract or reduced blood supply to the attached membranes of the digestive organs is carried by the nerves outside the stomach, resulting in vomiting. Medications. Some drugs, like chemotherapy agents, painkillers, or antibiotics, can irritate the stomach lining or affect the brain's nausea center through gastroduodenal vagal afferent nerves. Migraine. Not just a headache. Migraines often come with nausea and vomiting due to neurological changes in the brain. Pregnancy. Especially during the first trimester. Nausea, morning sickness, is driven by excessive amounts of blood protein called growth differentiation, factor 15, and hormonal changes. In severe form, doctors call it hyperemesis gravidarum. Feeling of headache and nausea during or just before period or menstruation is also hormonal. It comes under PMS, premenstrual symptoms. Other disease conditions like liver failure, increase of urea and ketone bodies in blood, as in kidney diseases, adrenal gland insufficiency, thyroid and parathyroid diseases are other metabolic vomiting with pancreatitis, cholecystitis, and appendicitis results from visceral irritation and temporary paralysis of bowel, known as ileus. Most of the time, nausea and vomiting are harmless and self-limiting. But sometimes, they're red flags for something more serious. Brain issues, like increased intracranial pressure from head injury, brain tumor, or stroke. Heart attack. Especially in women, nausea can be a symptom of cardiac trouble. Appendicitis, pancreatitis, or bowel obstruction. These come with severe pain and vomiting and often need emergency care. If you're vomiting and it feels like a horror movie scene, lots of blood, bile, or it just won't stop, don't wait. Get medical help. Believe it or not, vomiting is your body's defense mechanism. It's trying to protect you. When you eat spoiled food or ingest something harmful, your body wants to get rid of it before it's absorbed. Nausea gives you a heads up. Vomiting does the dirty work. It's your gut's way of saying, eject, eject, like a fighter jet pilot bailing out of a bad situation. Here's when nausea and vomiting aren't just annoying, they're potentially dangerous. Vomiting lasting more than 24-48 hours may have different complications, especially in young kids, elderly people, or pregnant women. Vomiting can quickly lead to dehydration and electrolyte imbalances. Signs of dehydration you should look for: dry mouth, dizziness, very little urine, high fever, confusion, or severe headache. Blood in vomit, bright red or coffee ground appearance, what doctors call as Mallory-Weiss tear. Severe abdominal pain or bloating. Okay, now let's talk about solutions. You're feeling nauseous? What can you do at home? Hydration. It is the key. Small sips of water, clear fluids or oral rehydration solutions. Ginger tea or candies. Ginger has natural anti-nausea properties. Brat diet. Bananas, rice, applesauce, toast. Gentle on the stomach, cool compress. On your neck or forehead can help fresh air. Sometimes just stepping outside makes a difference. And no, don't go sniffing pizza when you're nauseous. That's a quick way to meet your bathroom tiles face first. Sometimes the best treatment is prevention. Here's how you can avoid nausea triggers. Stay hydrated throughout the day. Avoid greasy, spicy, or overly sweet foods before travel. Eat small, frequent meals instead of large, heavy ones. If you're prone to motion sickness, sit in the front seat, look at the horizon, and avoid reading or using your phone while traveling. Practice deep breathing or mindfulness if your nausea is stress-related. And if someone suggests roller coasters right after dinner, they are not your friend. Anyways, how do doctors diagnose you? Your accurate information regarding your episodes of vomiting and timelines help to suspect the cause. Vomiting within an hour of eating, sustaining for a long duration, suggests obstruction in the digestive pathways. Vomiting occurring minutes after meal consumption prompts considerations of rumination syndrome. Blood in the vomiting raises suspicion of ulcer, cancer, or Mallory-Weiss tears. Vomiting can relieve abdominal pain from obstruction in the digestive system, but has no effect in pancreatitis or cholecystitis. Brain-related sources are considered if there is headache or visual changes. Vertigo or ringing in the ear indicate inner ear problems. If your nausea and vomiting episodes are infrequent, not to worry much except for maintenance of hydration. However, in intractable cases, your doctors may suggest you certain investigations to rule out upper endoscopy or colonoscopy to detect ulcers, cancer, and retained food particles in slowing down of the stomach or intestine. Small bowel barium radiography, CT scan, and contrast radiography to detect bowel obstruction. Ultrasonography, easy and affordable to diagnose abdominal issues. Brain CT or MRI is done if nothing could be concluded in ultrasound or CT scan. Gastric empty breath test, manometry to detect neuronal degeneration, etc. When home remedies don't cut it, there are medications that can help. We call them antiemetics. Ondansetron, often used for nausea from chemotherapy, viral illness, or pregnancy. Domperidone or metoclopramide help with nausea from delayed stomach emptying. Antihistamines like dimenhydrinate or meclizine, great for motion sickness. Prochlorperazine or promethazine, used in nausea with migraines or vertigo. Warning: always take medicines as prescribed. Popping anti-nausea meds like mints, not a great idea. Nausea and vomiting are like that annoying friend who shows up uninvited and overstays their welcome. But understanding why they happen can help you deal with them better, or even stop them before they start. Liked the video? Hit that thumbs up, share it with someone who's got a queasy stomach, and subscribe to DocDecoded for more real talk on your health. Decoded with a dose of humor.